So we'll be starting with the reproductive health. है ना? So what exactly is reproductive health? In definition, what we say according to the WHO, the definition is given by WHO, it is World Health Organization. WHO said that if a person is complete with respect to all aspect of reproduction, that he is physically mature, emotionally mature, and behavioral mature and socially fit for the reproduction, then the person is known as reproductive healthy. है ना? Clear? So there are a lot of people who are emotionally strong, behaviorally strong, but physically not as strong. Okay, so they are not into the category of being healthy in terms of reproduction. So what are the problems and strategies for the reproductive health? The problem is overpopulation. Okay, why? Or the concern for the maternal and fetal health. Na? There are sometimes a female is not able to conceive pregnancy continuously, na? That will affect her health. Na? She may get some problem, or it might lead to death. So that is the problem. So there are some things that helps in having reproductive health, that is family planning. Okay, what is family planning? Practices that help individual to attain certain objective. What are the objective of family planning? So when the couples are not ready to have child, to avoid the unwanted birth. Okay, so that is a very important issue. uh, to bring about wanted birth, that is also to regulate the interval between pregnancies. Okay, these are the main objectives, to determine the number of children in family. So these are all things included in the family planning. And interestingly, India is the first country to initiate the family planning program. It was initiated in 1951. That you must remember that it is the NCRT line. Okay, so India is the first country to initiate family planning. It came with the slogan of "Hum do hamare do." You. So what will happen if the people start following the family planning? What is the benefit of this family planning? So it will improve the quality life of the people, obviously. है if we have sufficient resources, because a number of people will result in because you know that resources are constant. If there are less number of people, they will get fed up, or they can utilize resources good. But if there are a number of people increasing day by day, the resources will diminish, and there will be a problem for all the people. Their quality of life will diminish. 1977, there was a program named Reproduction and Child Health Care Program. That is very important. Okay, it was done to improve the quality of life. So, what are the steps to achieve reproductive health? How will you achieve the reproductive health? So, there must be some governmental or non-governmental agencies. Okay, media, both print and audio visual, like newspapers, news is on televisions, ad campaigns, that can create awareness program. Okay, if the people are unaware of these things, they will not be able to achieve the quality of health. Okay, so what are the steps? Number one step is that if there is any adult, parent, teacher, close relative, and friend, should provide correct information and be willing to open dialogue with young adults and children to sensitize them about reproductive health. So the second thing is introduction of sex education in school and colleges. People must know about the consequences of the sexually transmitted disease. Okay, so these are the most life threatening disease all over the world. Especially if you educate people, especially the fertile couples, marriageable individuals, about birth control, pre and postnatal care, infants, child care, importance of breastfeeding, equal opportunities to male and females. That will helping in bringing up the social conscious and healthy families of desired size. Okay, so this can be the steps. So if we create awareness about problems of population of explosion, what will the consequences of sexual abuse, what is how heinous was the sex related crime, what are the consequences. So provision and availability of strong infrastructure facilities and expertise. So those who are very capable of implementation, or those are very intelligent in implementation of health plans, when they can also help in providing medical facilities and all these things. Okay, so a complete ban on fetal sex determination. You know fetal sex determination, just to check the female feticide, because feticide means the killing of female fetus. Okay, a large scale child immunization program that can also help.